that's having any health care, really respiratory therapy is involved, because the very first thing you have to do in life is what? Breathe. And the last thing you do. And both I consider to be very holy moments. So we're involved in every aspect of healthcare inside both critical and in chronic patients. I can better their patient outcome by using the evidence-based medicines that respiratory therapy has to ensure they have less days in the hospital, less chances of going to an ICU. And if you can minimize those days, then you minimize mortality rates. And that is the end game. It has just been a really wonderful journey through respiratory and now into teaching respiratory at the very college that I went to. I just want everyone to feel very comfortable. I always start my classes, every one of my classes has a motivational quote that I find. Make something kind of fun so that they realize we're in here to learn to help save lives. I love it. I love it so much. Social media has done several things for me. I participate in all of the fun on TikTok. Happy Monday, everyone. RT Out Loud here, and I'll have a little bit of a serious conversation to talk about today. You know, and they laugh and we make a joke about it. But what has happened is they understand that I am participating in their world, but I'm understanding how they're getting their information. What effect is that called? Do y'all remember? I have other instructors though telling me that because I taught some classes in the fall, they now have seen a difference in the clinical practice in the spring. It's going to disassociate from that hydrogen. Why? The engagements from the students is that they got into this to better patient care, to better patient outcomes, and to basically just take care of other humans. And that's why as you go into mechanical ventilation, we have something we call optimal opening pressure. When they hear me talk about the passion of not letting someone suffer and sometimes having to stand up in kind of uncomfortable situations for the betterment of the patient. And if it were you going through the door, you would choose the people that I'm training and teaching because they're going to choose the right thing if I have anything to do with it.
Are you deflating the cuff while you're listening with your stethoscope, or can you hear that leak without your stethoscope?
You'll hear it. You want to hear it audibly without your stethoscope.
Okay.
And now I just want to share this knowledge base to the students, and so that they go out and not just be great practitioners, but be great teachers in themselves. Lead from where they are. I tell them every time they leave, go lead from wherever you are. If I don't need it, I'll return it, but if I do, that's valuable time I don't want to waste going and getting a mess. Oh, they love it. This class today that I was teaching, they want to be here and they want to be great. They separate almost immediately with this process that is reversible. I think I'll work forever. I love it too much. I want to do it in ways that I'm giving education from every way that I can, from social media, online, across state, across countries. The borders are non-existent now for education. I have people that talk to me from India and the Middle East, everywhere on social media. And how beautiful is that they are just trying to find out their whys and their better education towards the field they've chosen. If I can be a part of that, it's very rewarding.